Hi, Dr. Ginette. I use different therapies and different techniques here in the office, and I often get the question, what are the different lights and therapies that you use here in the office and how do they work? So I want to take a moment to share with you what are the different light therapies that I use here in the office. And so when you think of light therapy, you might think of having an injury. Let's say I'd injured my hand, and there's certain light therapies out there where we'll put the light on the tissues for a certain amount of time to really accelerate the healing time. And this will help, decrease the inflammation and improve the healing time of the tissues. And so that's a particular technique called tissue saturation. And this is very helpful, but it's not how I use the lights here in the office. How I do use the lights here in the office is with the quantum neurology work that I do. I use a specific light, and this is called a GRT light, and it helps to stimulate nerves. And so the quantum neurology work is really looking to test the parameters of the nervous system, and wherever there's a breakdown in that system with a specific protocol, we're able to rehabilitate that nerve to get it to function properly. So let's say I wanted to test the nerve called C8 here in the body. And so C8 originates in the base of the neck, and that nerve has different functions, but one of its functions, it will travel down into my arm and will help me grip my fingers in through this way. And so I can test someone's grip strength by seeing if I can uncurl their fingers. If I can uncurl their fingers by measuring the muscle strength, I'm measuring the muscle strength, but really indirectly I'm measuring the nerve function. If that strength is not there, from there I can use this GRT light and place it at the base of the neck, which is where C8 will originate from, the nerve root. And then what we'll see is when we retest that grip strength, the strength of that muscle will be restored. And so why would the muscle be strengthened? And so we know that the lights, the lasers and these lights will help to regenerate nerve tissue. And so the light was actually going to improve the ATP of the cell, which is the energy of the cell. So it increases the energy of the cell. It will help to increase the oxygenation as well as the lymphocyte activity. So all that really means is that we know that light therapy helps to regenerate nerve tissue. And so in a short period of time, I can use these light therapies to help regenerate the nerves. And I use it in that particular protocol with the quantum neurology work that I do. The other lasers that I use here in the office are actually used with the quantum neurological reset therapy work that I do, also known as the QNRT. And so I've got different colors here. I've got a green one and a red one, depending on what protocol I'm using. I might use the green one very often for immune function. And so I use these lights and will stimulate different neurological points. And these neurological points are found on the head as well as in through the body, different organs. And using these lights on these neurological points will help to stimulate those tissues. And so that's how I use this particular light with the QNRT work that I do. So hope this was helpful. If you'd like to learn more about these techniques, then you can visit us on the website at holisticwellnesscenter.com to learn more about these different techniques that we use here in the office.